Well, thank you so much for joining us. My name is Dr. Lisa Patel, and today we're going to be talking about rural energy transitions. Rural communities across the US, particularly those served by energy cooperatives, are at a pivotal moment. These communities rely more heavily on fossil fuels than the national average. And as prices for fuels remain volatile and aging infrastructure continues to affect local air and water quality, the consequences for health and well-being become more pressing. Meanwhile, new energy demands from industries like data centers and recent policy shifts prioritizing fossil fuels have prompted states to consider reviving coal plants and building new gas facilities. This means that the energy decisions we're making today could shape environmental exposures and health outcomes such as asthma, heart disease, and preterm birth for decades to come. This webinar will present findings generated by the Medical Society Consortium on Climate and Health, Stanford Law School's Policy Lab, and Stanford Center for Human and Planetary Health on renewable energy transitions and health in rural America. We developed these assets in partnership with organizations like Renew Missouri and Clean Wisconsin to investigate how rural communities can better be supported in evaluating their energy choices with a health lens. The session today will be in two parts. In part one, we'll be hearing quick summaries of the three reports that are launching today. And in part two, we will turn to our panelists to discuss the findings. So first, for part one, I'm grateful to the following to give us really high-level overviews to our three reports. So we'll start with Joby Bernstein, who will be presenting on our work with Clean Wisconsin. Joby recently graduated from Stanford with an MBA and previously ran for Congress in the 16th District. Josie Pierce will be presenting on our work with Renew Missouri. Josie is completing a JD degree at Stanford Law School. Kate Hoppy will be presenting our global report that brings together qualitative interviews with rural energy transition organizations with a literature review. She's a PhD candidate in public health sciences from Washington University. And finally, Dr. Brittany Keyes, who's Clean Air Policy Manager for Healthy Climate Wisconsin and a physical therapist, will be talking about what health data has meant for the work that they've been doing in Wisconsin. So I will now turn it over to Joby.
Awesome. Thank you, Lisa. Are you all able to hear me okay?
Yes.
Okay, perfect. Awesome. So today we're talking about the Namaji Trail Energy Center, or NTEC is the acronym we use. It's a proposed 625 megawatt combined cycle natural gas plant that's going to be potentially built in Northwest Wisconsin up in Douglas County. And so Dairyland Power Cooperative is the utility that was seeking a federal loan from the Rural Utility Services, which is part of a program under the Inflation Reduction Act. And so I was part of the graduate team that authored the detailed report to try to help assess NTEC. We conducted both a health impact assessment and also an economic analysis of the project, since those hadn't been done before. And this is kind of problematic because natural gas plants are known to emit toxic chemicals such as particulate matter, NOx, SOx, and especially carbon dioxide. We can flip to the next slide. It's these pollutants that are linked to asthma, heart disease, cancer, and infant health risks. So the estimated health damages that we found were in the millions for Douglas County alone, with a disproportionate burden on children, the elderly, and low-income communities. From an economic side, NTEC we found was more expensive, and we thought could be supplemented by better renewables that were just as reliable. And kind of one fear that we presented and outlined in our report was how NTEC risks becoming a stranded asset, where over time, we're seeing clean energy prices become cheaper and cheaper, and the remaining infrastructure of a large plant could hold Wisconsin's climate goals and also economic goals and affordability goals back. So since we published a report, a lot has changed with an election and different policies. But I think it's important to note that even if NTEC itself doesn't move forward, there are 100 more NTECs that are currently lining up behind it. And so the issues that we analyze and are going to be discussing today are central to how we build America's clean energy future. And so next, I'm going to pass it over to Josie, who's going to talk about Missouri.
Yes, so our next project in the Stanford Law Policy Lab was our team working with Renew Missouri to assess the potential health and economic impacts of closing the New Madrid coal plant and replacing its energy generation with clean power. The Magnitude 7 Metals aluminum plant was once a significant employer in Missouri's New Madrid County and contributed nearly 1/3 of national primary aluminum production. But in January of 2024, the Magnitude 7 Metals plant closed. The community is interested in reviving the plant, but there are concerns that exist about potential health impacts of relying on the New Madrid coal power plant, which previously supplied the aluminum smelter's energy. Next slide, please. The health impact assessment found significant health and economic costs associated with the New Madrid coal plant. Under current operating conditions, the plant is responsible for 98% of the county's nitrous oxide emissions and 88% of carbon dioxide emissions. Its significant sulfur oxide emissions also exceed national standards by 400%, making the county the only one in Missouri to be out of compliance with EPA requirements. In large part because of this plant, New Madrid County is the second worst of 115 Missouri counties in terms of human health. Residents have higher rates of respiratory and cardiovascular problems than the rest of the state. And while the economic and health benefits of renewable energy are well established, the transition to renewables poses socioeconomic risks for local workforces. So the team at Stanford recommends the full decommissioning of the New Madrid coal plant and transitioning to renewable energy sources to power the Magnitude 7 Metals facility. And in order to do this, they propose support programs for displaced workers, including job training, to help them bridge the employment gap. And next up, Kate will be speaking.
Thanks, Josie. So now that you've heard more about the findings in Wisconsin and Missouri, I'd like to share a brief overview of our national report conducted over the past year. So first, we conducted a landscape analysis of organizations working on rural clean energy transitions, interviewing 7 organizations across the country. And what we found was that the fossil fuel legacy is complex. Many families have worked in the industry for generations and see it as a source of economic stability. In some communities, there are also cultural ties, like the preference for gas cooking in Latin communities. Still, there are growing awareness of the pollution and health consequences, and that health framing shifts perspectives. When residents learned about the health impacts of new fossil fuel infrastructure, such as in the INTEC case, they were more likely to oppose it. And that messaging delivered through trusted messengers matters. Faith leaders, farmers, local businesses, and elected officials were identified as key influencers in rural communities. Diverse groups are also driving change. So organizations are working across electrification, weatherization, solar deployment, and community education, reflecting the varied needs of rural communities. So next, we conducted a scoping review of the health impacts of rural energy transitions. Research is still limited, but what we found was that each stage of fossil fuel production harms human health, from in utero to older age, contributing to issues such as preterm birth, asthma, cardiovascular and lung disease, dementia, diabetes, and cancer. And that impact extends far beyond communities where fossil fuels are produced to those beyond the source of the pollution itself. Transitions must also be managed carefully. As you've heard, plant closures without economic replacements can reduce local tax revenue, increase unemployment, and strain public services. And finally, what we found was that there's overwhelming demand for the Empowering Rural America program. $13 was requested for every $1 of funding available, showing the broad interest in clean energy. As federal priorities continue to shift, it's vital that rural communities have full information, including on the health impacts, when evaluating new energy projects. And so with that, I will hand it over to Brittany.
Thank you, Kate. I'm very grateful to be here with this panel. I'm from Healthy Climate, Wisconsin. We are a statewide organization of health professionals advocating for just health and climate solutions. And I had the honor of being part and leading the organizing of the grassroots opposition with leading the health messaging with opposing NTEC. And as Joby shared, this is incredibly important, especially in this moment where the federal positions have changed, and even in Wisconsin, we're experiencing a gas rush. And so instead of retiring our gas plants, we're seeing more and more proposals statewide. I reside in Beloit, Wisconsin, and so I'm in the south central part of the state, and how I became connected with Superior is when I was a volunteer member, our executive director reached out to a local leader, former Counselor Van Sickle, who was speaking out against this proposal, appreciating there's harms, the benefits are not outweighing what is the negative impacts to her community. And so knowing that, so in Beloit, we are a small industrial community. We live in the fallout of a large methane gas plant. We have the negative health, living and breathing the negative health impacts. And as we all want to achieve prevention we all want to achieve prevention. And so I knew that appreciating what they were dealing with in Superior and facing, that we needed to work together to help prevent it. So as many great conversations and efforts start with a conversation from the kitchen table, I was connected with Counselor Van Sickle, and we appreciated that we needed to get this messaging and the health harms to their local community. So Jenny was able to connect me with trusted messengers through the local League of Women Voters up in Douglas County, and we organized 2 different community sessions, and I was honored to be the featured speaker, a part of 2 different panels, 2 different days. Up in Superior. And our goal was to really help reach as many people as possible. So from a Tuesday evening and a Wednesday afternoon, we offered really the health impacts of what this gas plant would mean to their community. And so I was able to be in a panel of fellow members from Healthy Climate Wisconsin, tribal leaders, physicists, to talk about like the sound and the health negative the impacts from sound pollution, and the room was packed. Local communities want to know how these gas plants are going to impact them. The utilities often say there's nothing negative that's going to come to you. They have very strong PR, and so when we presented the health impacts, the impacts to Native communities, environmental impacts, after we spoke to this room full of community members, leaders, for over an hour, the room was silent. And it was because they knew they didn't want this to happen to them, right? And so like the health messaging of, as what Joby shared, like who this harms. I remember that there was an older gentleman sitting in the room on oxygen, and he was in tears, and he just rose his hand and he said, I bought my home because this is where I wanted to retire. And what am I going to do? I don't want this to happen to me. And so really at that point, as an organization of health providers, we stepped back and supported the local community who rose up and came together and said, we can't let this happen here. And so that's when Neighbors Against NTEC formed, and other Clean Wisconsin, Sierra Club, and others supported the local community in helping them organize with developing flyers, yard signs, even subsequent community events, where then I shared, since I had first presented to the community, my town received the designation of the most polluted regional city in the U.S. So the most polluted small city in the U.S., largely because we started community monitoring, not because the regulators were taking concern. And so often where these utilities look to build out are ones that are under monitored, and more vulnerable. And so we were able to support the Superior community in preparing testimony and testimony prep. And then they organized a amazing rally. From the testimony prep, they had a rally where they marched to City Hall. They packed City Hall. They were able to stand in front of the plan commission and say, I am your neighbor and I don't want this because we know the negative health impacts this will bring. And then beside them and following them, we had health providers come. A local med student testified with her white jacket and her white coat, standing beside her neighbors, and led powerful testimony based upon the health impacts. And then the plan commission voted to deny, and then later when it came in front of the city council voted to uphold the plan commission recommendation. And so this is just an amazing victory and demonstration of the power of health messaging and supporting local communities. And I'm excited to share how the research can help support us and how we can take this forward in opposing other harmful proposals throughout the country.
Thank you so much, Brittany. We appreciate you sharing the work and the perspective that you've been able to do in Wisconsin. Now I'm going to invite my co-moderator to join me, Deborah Sivas. And Deborah, I'll let you introduce yourself really quickly.
Hi, Lisa. Thank you. And thanks for the great panel so far. I'm Deborah Sivas. I co-taught this course with Lisa and a teacher at the law school.
Wonderful. And so I'm really honored to welcome our panelists to discuss everything we've just heard and also provide their expertise. So first is Brett Corti. He's a staff attorney for Clean Wisconsin. Philip, I'm so sorry, Philip, you told me your name a number of times. Frasika, Director of Programs for New Missouri. Jenny Van Sickle, who's a council member for Superior, Wisconsin, and Holmes Hummel, who's Managing Director of Energy Equity and Just Transitions at the Precourt Institute for Energy at Stanford University. Thank you all so much for joining us. And I'll let Debbie, I'll let you start with the first question.
Oh, great. Okay, so we're going to just jump right in. And everyone should feel free to answer in the panel. So with an increased demand in energy and the dismantling of the Inflation Reduction Act, delivering on clean energy projects has become more difficult, as we're all coming to understand. So what do you all see as the path forward to continue this work?
You to pick one of us, or I can get us started.
Get us going, Brett. Thank you.
All right, great. Well, first of all, I just want to say a big thanks to the Medical Society Consortium and Stanford for the great collaboration on this project. It was great working with the student team and faculty, and we're super grateful for their work. I'm a staff attorney at Clean Wisconsin. We're a statewide environmental advocacy organization. We're involved in all kinds of issues, but my work primarily focuses on climate change, energy, and air pollution. So to get to the question, if the IRA was a peak on the climate policy roller coaster, I'd say we're in a valley now. There's a lot of uncertainty about the IRAs, specifically the investment tax credit, even with projects that are pretty far along in the development process. So that's kind of the carrot that got taken away for renewables to some extent. And on that side of things, I'm really hoping that the economic voices get through, utilities, developers, and economists that are worried about the US's kind of global standing in the clean energy economy. The IRA was helping kind of move the US back towards a leadership role in this space. And I think, there's implications for national security and, national economics that, I just don't understand how the decision was made given those considerations. But what we're seeing right now just seems like such a backwards and costly policy shift. So from an advocacy perspective, I think we need people to communicate with their elected officials, state, local, federal, everybody, communicate with their utilities and the regulators that are in charge of those utilities, that they want clean energy for their communities. And regarding the increase in demand, I think that decision makers need to be really critical about utilities and large load customers like data centers and their plans for what they're projecting over the near and longer term. And I think that regulators need to get really creative about things like energy efficiency, demand response, distributed generation. All of those technologies and programs have the potential to mitigate the load growth issues. Many of our fossil fuel plants are primarily used for the times where we're at peak energy demand. So if we can avoid some of those peaks with load management efforts like demand response at these large load users, we can avoid turning on some of these fossil fuel plants and maybe even building some of the new ones. So that's kind of where I'm looking at this moment. I don't have a great, silver bullet solution. If I did, you'd all know about it, but that's kind of where I'm looking at things right now.
Great, thank you. Philip, you want to jump in?
Sure. Philip Ruzicka, Director of Programs with Renewable Missouri. Also want to thank the consortium in Stanford for the assistance in working with us and for putting together the health impact assessment. It's already been really helpful and will continue to be helpful in our advocacy across the state. So one thing that has really brought me some optimism in this tough time that we're finding ourselves in, a most recent study of the Lazard levelized cost of electricity that came out in June shows, really a good comparison of utility scale systems, looking at utility scale renewables and storage projects and how those stack up with existing fossil fuel plants. They're still very competitive. In most cases are going to come in at a lower cost than that fossil fuel new build will have. So the economics are still there. We're still seeing utilities invest in these projects. So as long as that is continuing to happen, while it's going to slow things down, I'm still optimistic that we'll continue to push forward in investing in renewable energy. And once we get through this, little having now, costs are going to continue to come down, and it'll just be an even more favorable option for rural communities across the country.
I'd be
Great,
happy to
Yes,
join
Holmes.
you in this dialogue. First of all, acknowledging the outstanding work of the students in the course and the value of the product and the value of the readership, including the hundreds of people that signed up to participate in today's webinar and those that could make it live. The majority of people in the United States live in state jurisdictions that have a law to end unmitigated fossil fuel pollution by a certain date. That's so important to remember, that the majority of people in the United States live in a jurisdiction where there is a state or local law that designates a date certain after which unmitigated burning of fossil fuels is not acceptable. When we remind ourselves that there are multiple levels of authority and these overlapping jurisdictions, we can start to use local and state officials to be representatives and to contest for the authenticity of that representation, even at the federal level. I also want to say, from my vantage point, both at Stanford and with Clean Energy Works, that the electric cooperatives are underappreciated for the capacity they have to make new investments with very low cost capital, with very, very competitive price points, as Philip just described. But very few state and local officials are fluent with those utility leaders for rural communities. And most of the member owners of the rural electric cooperatives are not familiar with the annual elections for who represents them to the board. These are potential paths forward.
Gynnych chi Shohan, Ayachat Jenny Van Sickle, Kitzadi Raven Gachihin. I'm a former city council member, like Brittany, up here in Superior, Wisconsin, where it is 90 degrees again, so not a climate haven. We haven't seen the sun all summer. A lot of summer activities here have been canceled because of the smoke, and a lot of winter activities were canceled for 2 years in a row because there's no snow. So that's been very expensive, but I just want to share, I think, just a different perspective when it comes to elected officials. And one being that facts are not a consideration when you have ambition. Now, I didn't have ambition to take another office, and I studied social work in college. I studied community organizing and public policy. So I just sort of fell into this work, and I'm not from Superior. I was born and raised in Alaska. And so I didn't know anything here. And I just got to speak with a lot of authenticity. And I'm super grateful for that. but ambition in your local offices is going to be one of your biggest hurdles, no matter how many documents. Also, becoming fluent in utility law and policy is really important because over here in Wisconsin, if you remember in 2011, state Democrats fled our capital because the gerrymandering was so severe and Act 10 was being proposed and passed. So Wisconsin is a state that has been one on the cutting edge of progressive policy for its lifetime, and has spent the last almost 20 years clawing its way out of a trifecta. So how we got this done, I think, will always be nothing short of a miracle, but it was a really strong voice from the tribes because and I'm going to tell this as quickly as possible, because in 1918, U.S. Steel came to Superior and said, hey, we're going to save your town. And everybody was like, yay. And the only problem is there was a sacred burial ground where Chief Osagi had been interned, one of the original signatories of the 1854 treaty. They dug up 200 indigenous bodies and moved them across town and dumped them in a mass grave on the river. And then U.S. Steel was like, anyway, it's a sandbar, we can't build there. And I'm saying this as abbreviated as possible, NTEC was slated to be built nearly on top of that mass grave. And all people could say was like, oh, jobs. And so I started reading everything. I went back to page 1 of the CPCN application and just started highlighting everything that I didn't understand or that I knew was a flat lie. Low quality wetlands, that was a verifiable lie. No tribal land within 50 miles, verifiable lie. And then I spent the next 18 months at this computer, sick for most of it, just trying to get anybody to listen to this like Port City, this little native city councilor who was speaking, out of turn and above her pay grade. And, the regulators and the utility are like thick as thieves. And, they have a really strong network at the state level. And then Brittany showed up, and people that were really on the fence or really curious. To this day, people in Superior, many people in Superior could not tell you what an NTEC is. The narrative, though, was so explosive. Hundreds of people from the construction industry. And just a few days ago, the federal government issued a permit. So this is a project that's been limping along since 2002. And it's not the exhaustion, it's just the hyper vigilance of being publicly gaslit, people outside your home. It was an extraordinarily traumatic experience, but the good news is we did win. And it was local officials, because nobody is coming to save you. Nobody.
Well, Jenny and Brittany, thank you. And thank you so much for this perspective, Jenny, and for keeping at it through what sounds like really both traumatic and terrible times. I want to turn a little bit to talking about health in particular. Health is often overlooked in energy planning, but the evidence is clear that energy choices can have lifelong consequences for community well-being. So from your experience, what has been effective in getting health impacts into the room before decisions are made about coal or gas projects? And what do you think still needs to change? And maybe let's take it in the reverse this time. Jenny, maybe we can start with you.
Yeah, we had really public people on the news saying what was emitted from the smokestack was clarified steam. Unmitigated, unchecked. And so you'll see there are a lot of neighbors here on the call here, and they just learned how to read all the permits. The micrograms per 100, 2 p.m. The EPA was lowering it at that time. Just community citizens, nurses, they just learned to read everything from one identifying in Wisconsin, the state does not identify a projected increase in energy. So that was super unsubstantiated here in Wisconsin, but the neighbors against NTEC, they went door to door to door. And what was unique was that this was a neighborhood that had not typically borne the brunt of environmental burden. You know, it was not a CDBG neighborhood. It wasn't a neighborhood that had really experienced this. So that was a new turn as well. And they 100% did a really good job, one, talking about property values, and two, absolutely, you would notice this, you would hear it. This would be an everyday emotional vigilant burden, particularly with the air quality that we now are super cognizant of here in Superior. And somebody mentioned we do have the only refinery in the state that had exploded some years ago and made national news. So people here are very aware of the risk and the danger of living this close.
Thank you, Jenny. Holmes, I'll turn it to you. You were a close friend to us as we were developing these reports in terms of health. I'm just curious from your perspective, working in the space for a long while, where do you think health fits into this?
Well, part of the genius of what the councilwoman is describing is expanding the constituency of champions who can attest to the harms and the options to avoid them with a depth of conviction that's not easy to dislodge. Bringing healthcare officials, including registered nurses, people who are a part of little league sports programs where kids have asthma attacks in the middle of a soccer game, parents groups, and others who are taking care of elders who see firsthand the effects of some of the maladies that are already documented in the report released associated with today's program. They are important messengers to pierce through the bubbles that can develop in the conversations between utilities and regulators if not addressed by people with health care expertise or direct impacts from the health concerns. I hope that that's a helpful contribution to this part of the dialogue to encourage many of the people who are here today, use the chat box to introduce yourselves, to describe the depth of expertise or motivation that brings you to the conversation, and then to think about who people might be who have similar types of backgrounds or skills in your community that can be allies in the conversations that need more perspectives.
Thank you so much, Holmes. And that actually transitions perfect to you, Philip, because one of the things we encountered with the student group, there was a huge disparity between Wisconsin and Missouri. We did have some challenges finding those health voices in Missouri. I'm just curious from your point of view, because I know you all have used the report in terms of the health impacts. How do you see health playing into it? How can we bring more health professionals to the table?
Yeah, so I mean, broadly, we just need more voices in our utility cases. And what Holmes was really addressing and speaking to, that, I mean, it's great to get those health voices in there. It's something we haven't had before at our Public Service Commission in Missouri. We've not had any interveners with a health perspective getting in front of the PSC commissioners and talking about the health impacts of some of these new builds for natural gas plants. So I definitely think that's something that would be helpful, and not just a situation of folks in the health industry, but also looking at local governments getting involved. They can also intervene if they're a customer of a utility. We haven't really seen that very frequently so far in the state. We have had more recent conversations with elected officials that are a little more cognizant of some of the rate increases they're seeing and having concerns on some of the actions we're seeing federally that are going to continue to raise rates. So getting those outside voices that typically haven't been involved in these cases to get involved and to bring up those other concerns would be extremely helpful. And having the health impact assessment available to us is going to be helpful in our advocacy and our work in those cases, We typically haven't talked about health as an organization. We have when we can, but we haven't been able to quantify it until now. So we're very thankful and appreciative to have the health impact assessment, to be able to cite that, to be able to use that in our work and our advocacy, because we can now effectively speak to the cost impacts that we're seeing, and that there really is, a dollar value to those increased health impacts that we're seeing. And we haven't been able to say definitively what that'll cost. And with our more conservative elected officials, that tends to really get their attention more than some other issues. So I think that will be actually quite effective there locally and across the state.
Thanks, Philip. And Brett, Wisconsin, thanks to y'all and to a council member and to Brittany and Abby Lois Novinska, who I've noticed on the call as well, I feel like demonstrates sort of the model of what we're hoping for in terms of how health professionals show up in partnership with the community. I'd love to hear your perspective in terms of how health has played out in Wisconsin.
Well, I think the NTEC example is a really good one, because this is a real challenge here in Wisconsin. The laws governing our power plant construction do explicitly prohibit the Public Service Commission from considering the impacts of air pollution. This point was raised in the chat, with the reasoning being that DNR is in charge of the air pollutants in the state. That's all true, but I think the PSC has more authority on the issue than they've been willing to exercise. And that means that we need change through the political process or to focus on other decision makers. And we've seen that in Superior with denial of local municipal permits. I think a lot of that, like we've been hearing today, was directly related to raising health concerns to folks who had a decision in front of them. And I think we just need to keep elevating that concern to the point that it is able to influence agency decisions at a statewide level. And whether that's convincing the Public Service Commission to exercise more of its authority, or putting political pressure on the commissioners to consider the impacts to communities, and having the health assessment in hand is going to allow us to continue pushing on NTEC, but also inform how we'll think about other fossil plants going forward. And if anyone has any ideas, I'm all ears on these issues as well.
Thanks, Brett. I think we could probably do a whole panel on the politics around this, right? So we'll invite everyone back. But maybe we can take a little deeper dive into what would be helpful for you all to bring to this conversation. So we know that data can be a powerful tool, but only when it's accessible and trusted. And so what kinds of health data or community stories have resounded most with the rural stakeholders and decision makers in your work, and how might we improve the use of health information in shaping these public conversations? Who hasn't started? Maybe we'll start with Philip. Let you start us off.
Yeah, sounds good. So yeah, one piece from the health impact assessment, one piece of data that I've been referencing, and I hope we can continue to point out to Missourians, is the estimated cost of the health impacts and health challenges found that it was at approximately $731 million annually. And then combined with the societal cost of air pollution, it came out to an economic toll of $1.68 billion. And that's for one coal plant. We have multiple across the state. That's for a single coal plant in a single community. So if we're drawing that out to the entire state, even our largest utilities have at least 50% of their generation mix coming from coal. So we know that this is impacting areas well beyond New Madrid and that specific county in Southeast Missouri. So I think that's going to be really helpful in our advocacy there specifically, and really tying that into other natural gas plant decisions, looking at keeping existing coal plants active longer instead of retiring them early. So really just trying to get that in as much as possible and letting people know that there is a cost beyond just their utility bill when considering some of these changes to plants across the state.
You're on mute.
Oh, sorry. Apologies for that. Thank you, Philip. We're all thinking about data and information these days, and given the larger zeitgeist. So maybe Jenny, follow up with you about what data you think might be helpful at the local level to really move the conversation.
Well, I think one thing that was helpful is certainly when you can draw distinction on your area. So Brittany presented a lot of data around cancer rates in Superior and how those were already higher than other counties in the state. You know, Wisconsin is maybe the last state yet that hasn't accepted the federal Medicaid expansion. So healthcare, access to healthcare is already challenging for people. And, you know, we have the only municipal landfill, the only refinery. We have over 50 waterways in Douglas County alone that are impaired, and we just kept saying that over and over. And that things that you can quantify. Brittany also did a really good job of just giving it a name, and it was a pollution haven. And Superior had been saying things like that a while, like we're not Duluth's dumping grounds or things like that. But I feel like the word pollution haven, just taking all of those facts and figures, we just gave it a term, and that seemed to really stick instead of just rattling off, you know, all these statistics, but they knew them.
Great, Brett. And Brett, how are you thinking about this and the kinds of data that we might, you know, some folks on this webinar might actually start thinking about developing to help all of you at the local level?
Yeah, I mean, I need one of these reports for every single project, right? And because I think, like Jenny was saying, it's the localized and very specific data when you can say this project is going to cause this many more incidences of asthma or cardiac disease or whatever it is. That really resonates, and I think, you know, there's plenty of data about climate change globally and fossil fuel pollution globally, but it really needs to be specific to both the residents in the local community to help them, you know, take ownership of it, but also the elected officials, because you're telling them like this is a burden that your constituents are going to feel. So more of that. I think the NTEC study is a prime example of stuff that's really useful, and you know that it's our job to get that in front of the right people at the right time. And you know, one kind of quick example, several years ago, Clean Wisconsin, just pulling USGS data, was able to show several municipalities in Milwaukee that 75% of their PHAs, which don't make me say the full name for that chemical compound, but it's basically from pavement sealants on parking lots and stuff. And when presented with that information, that it was one source and, you know, that's what your problem was, without fail, every single municipality that had some authority took some sort of action. So we've seen it in Superior. We've seen it in those instances where if you show elected officials and leaders that, you know, this is exactly how it's going to impact your constituents, your communities, that's the most impactful thing. So Clean Wisconsin is happy to partner with Healthy Climate and other groups that are trying to get that message across. And we've even recently kicked off our own environmental health initiative to do that exact thing and try to get as specific as possible and get real data on kind of project by project in front of the decision makers.
It sounds like we need to replicate this effort at the retail level all around the country.
Yeah, I got a list for you if you want to hop on.
Holmes, and do you want to jump in and add some thoughts here?
This question strikes at the heart of distributive justice. Who are the people who will pay for the hazards and the harms? And it is an age-old story that communities burdened with fossil fueled pollution do pay for it with their lives, and specifically their life expectancies. Data about hazards and harms that have been documented in other locations where fossil fuel pollution has wrought the kinds of hardship that I've described in the report distributed today are important to address to constituencies who can be self-determined about whether to accept them. I have seen community organizers go to the county commissioners and ask for the county commissioners to pass a resolution, simply recognizing that if a harmful project moves forward, these hazards are known and that the costs will be incurred. The question is by whom? And if the community members can be in a civic conversation about whether or not to accept those hazards or harms, it can fortify their voice in the intergovernmental tension between the state and the local officials of what should happen in that place. Before I end on this third of the four questions I've been briefed on, I just have to say, in the wake of changes in federal policy enacted on the 4th of July, rural health centers are in a more precarious situation than ever before. And it is not entirely clear that people who need health care in rural communities will be able to rely on the same quality of care that was even presumed in the calculation of these estimates. That's difficult to face, but I think it's part of the civic conversation about what's being expected when people in the city need power and want it from the countryside.
Thanks so much for that, Holmes, to provide that perspective. And if folks are not familiar, in the quote unquote big beautiful bill, there are cuts to Medicaid that will come into effect after the midterms next year that are expected to have pretty devastating effects in terms of rural healthcare access. So compounding the issue in terms of health impacts, we'll see decreased access to care as well. We only have a bit of time left, and rather than this fourth question we had talked about, there's some really great questions from the audience that I'd love y'all's perspective on, and if that's okay. And I do want to take this first one from Kathleen Shapley Quinn, who asks that AI might double our energy needs within the next year, and it's hard to imagine how fossil fuels or renewables could rev up enough to accommodate this demand. And Holmes, maybe we'll start with you on this one in terms of what your perspective is on this.
I'm pleased that Stanford has recently carried the news that a company called Grid Care identified an enormous capacity of underutilized grid capabilities for hyperscalers that should take a lot of the heat in the near term off of the imperative to build just for artificial intelligence. So you can look for the press releases for grid care and the gigawatts that have been found to be available in the existing grid. I want to underscore Brett's earlier remarks that when jurisdictions are concerned that new electricity users are going to exhaust the resources that need to be available so that there's adequate resources in the system, that resource adequacy can be assured with more demand side flexibility, which is to say this: we don't have to always buy new generation to accommodate new electricity uses. We often can add flexibility to the system to moderate demand. And a ubiquitous example of that would be our water treatment plants and our hot water supply systems. Stanford professor Megan Mouter is an expert in this area whose work is very inspiring to me. When we add it up, there is a tremendous amount of capacity that could be more flexible and at a much faster pace and lower cost than standing in a half-decade line for a new gas turbine from GE Vernova. So it is important for us to think about alternative ways to meet the demands that are expressed in the economy.
Thanks, Holmes. I know, Brett, that Wisconsin has been dealing with this issue actively because Wisconsin seems like it's going to be a popular place for AI centers. I'm curious your perspective from Clean Wisconsin.
Well, I really can't wait to check out the Grid Care report. We're looking for those resources to help us address this issue. We've got several data centers in the works right now, and already saw some gas plants approved to serve the load for one in particular. And we've got ongoing tariff dockets. So, the tariffs that these users will take under, and there might be ways to influence, encourage some of the demand side stuff or bring your own renewables, any of these policies through those decision-making processes. But, Holmes has an optimistic view maybe, and I'm grateful for that. But I'm really kind of looking around and trying to figure out what we're going to do about the demand from data centers. And I think it comes back to all of the local electeds, any elected official, right? Sometimes your local governments are going to have more ability to kind of get things they want out of the end user customers through tax incentives and other structures. We got to think about kind of all the tools in the toolkit of ways to mitigate this growth. And I'm hopeful that maybe once we get through this initial boom here and rush to market, that all these big tech companies have their own clean energy goals and sustainability policies, and right now I just don't see how they line up. And I'm really hopeful that they'll start to take some ownership and leadership for the build out of fossil fuel that they're responsible for. Because right now you have utilities and regulators a lot of times saying, "Oh, we have to serve load as it comes. We don't have any, we can't discriminate against the types of customers." And it's a moment where I think we need to be collaborative and look for every solution that we possibly can. But certainly something that, is on my mind most days right now.
Thanks, Brett. Jenny, how about you? Would love to hear your perspective.
I come from 2 warrior tribes, so I am just like always on 11. But I will say that when we were really in the height of NTech, I met people that I had never really met before, because they were like deeply on a different side of the political spectrum than me, who were some of the most vocal people against it. And there were 2 sort of uniting factors: utility bills and Lake Superior. It's something almost everybody agreed on. So that was always a good start. But I think there was a big boom of natural gas in the state in 2024 just based on availability. So it started in the late 90s, went to the early aughts, and then fell off when gas prices went up and they started retrofitting gas plants to support diesel and things like that. So we have been through this cycle before. But I think too, with data centers, in the middle of NTech, when things were really starting to look like they were not going to have the votes, they did privately approach our planning department and proposed a data center because they could not demonstrate need. Remember, merchant plants are based on greed, not need. So a lot of people knew that the energy was not for Superior. They knew it was going to the La Crosse area, so that was important too. But we would end up paying for it. And we were able to kind of say that, like, they're not, it's $1 billion investment in them. They're not investing in us. They're investing this plus 10% for themselves. So monetary, because I think too, when people see technology, they just think it's synonymous with progress. So they will continue inventing need through these data centers. I just hope that people will see it's not for us. It's not, Wisconsin just reestablished its film office. So I think that artists are really getting just a more united voice to even do away with the need for as much AI as we're seeing. It's just, they need construction. They will build this, they will build the next thing. It is based on construction. It doesn't matter if they abandon it later, we still pay the bill. And those are just things that, the utilities mission is in direct conflict with the public interest. So these are 3 people in Madison that never put their name on a ballot. It's a tough place to be in.
Thanks so much for that perspective. And Philip, I'll let you wrap up this question and I'll turn it back over to Debbie.
Yeah, so we're just getting started with this issue in Missouri. We haven't really seen a lot of them come on, but my general view of it is it just seems like they're really all clamoring to hurry up and wait. When we're looking at having new natural gas fossil fuel buildouts to power them, it's going to take years. So if the demand and interest is really coming on as rapidly as we're seeing reports we're saying it's going to be, that I don't know how you would power them without having renewable energy, because you can get those projects built a lot faster and connected to the grid. So that really seems like the easy solution if you want a bunch of power to do that. We've also had flat growth in Missouri for demand for electricity. So we also don't really have proof that there's a need to have, a big increase in generation. So back to what Holmes and Brett have been talking about too, of energy efficiency, if utilities can invest more in that and reduce the needs of customers, they might not even really need to build that much when we finally get to that point of a data center, if we can use what we currently have more effectively.
Thank
And I
you.
would just say that there's more than 10,000 people in line to connect to the grid. So generation isn't exactly the problem.
That's a really good point, Jenny. And again, we could do a whole webinar on that interconnection to the grid. Well, just as we're wrapping up with a few minutes left, I thought we would give each of you a chance to just wrap up. This has been a great discussion, really bringing different perspectives to the table, and there's a lot more to talk about. But wanted to give you each a chance to just give us any final parting thoughts or points of optimism. I think some people on this panel are more optimistic than others, but so maybe we'll start with you, Brett. How about we start with you?
Thanks. I'll just say thanks again for having me, and thanks again for the collaboration with Clean Wisconsin. It's been really great to work with the whole team and to see the final products. I guess I'll just encourage folks to get involved with where their energy comes from. You might know who you get your bill from, but figure out who the parent company is, figure out if you have a rural electric co-op, figure out if you have a muni, and figure out how you can influence the decisions that are happening with your utility itself or the folks that regulate them. Working in the energy law world, it's just kind of boggles my mind how important these agencies and companies are to everyone's everyday life, and how little folks kind of know about them, and how little accountability they can sometimes have. So that would be my ask and closing thought. Thanks.
Thank you, Brett. And Philip, let's turn next to you because you were the other community partner that we worked with closely.
Yeah, I just wanted to also say thank you so much for putting the work together for this health impact assessment. It's going to be very helpful in our advocacy now and years ahead. One piece of news that I can share is that Mag 7 Metals, the aluminum smelter that's covered in the report, is actually looking at repowering the plant soon. So we're definitely going to be using the report in our advocacy to strongly encourage them to look at powering that with renewable energy and not continuing to rely on the old coal plant. So I will update you all on our progress there, and really looking forward to staying engaged here. Thanks.
Yeah, that's great news. Definitely keep us apprised of that. That'll be fun to follow. Let's turn it to you, Holmes, next for any wrap-up thoughts.
What a privilege to benefit from the research of the students that participated in the Cardinal course and their community partners here in Missouri and Wisconsin. A privilege to be here with Councilwoman and the brave souls that have been chiming in on the chat to testify for what it looks like to bring health impacts to the civic discourse around our energy futures. I think that Stanford University continues to be a resource and an interested party in producing public benefits through these types of collaborations. And I want to thank Lisa, Debbie, and all of the people, including Lucy, who's here today, that helped make that possible.
Thank you, Holmes. And Jenny, we'll go over to you for some closing thoughts.
I guess I would just say lean into the frustration, because this process can be something of a publicly emotional beatdown. And I think I have to say it was like one of the most dehumanizing processes I've ever gone through. People that just won't return your call, and having a very difficult time with the DNR, just trying to learn everything I could. And just the brazen, they can lie on the news, they can lie in a billboard, they can lie in an ad, they can lie on the radio. It's everywhere, but just stay focused forward. Just keep putting that out there, because like I said, there were people picking it up that I didn't even realize. Just every time I would get like a nasty email about it, I would read for 5 more hours. I absolutely leaned all the way in, because there was nothing else I could do to fight back. It was just keep reading. I just researched everything. So just lean all the way in.
Great. I'll close this up, Jenny, and to everyone here. Thank you, everyone, for your dedication to this cause. It's important work. And Jenny, as you say, you know, we're fighting. We know we're fighting for the right thing in terms of health and justice, and so we just have to keep at it. Savannah has dropped the links for the reports in the chat. So please check out all 3 reports, 2 of them that were generated by the students that were health impact assessments in the global report as well. And please reach out if you have any other questions. Thank you so much for joining us today.